Information technology in the health field is becoming increasingly important and critical to our practice. Medicine is really undergoing a transformation in this area. Our Tara Jones shows us just how health IT is taking center stage at the ACC.10 and I2 Summit.
I'm here with Anish Chopra, and he is the White House Chief Technology Officer. Now, Mr. Chopra, tell us, in what ways can health IT improve quality care while we move into the future?
I would say there are three ways that would be of top of mind interest on my side. First, there's information about patients that may not be readily available to a clinician at the time they're treating the patient. So first idea is to ensure that you have the information you need to make the best decisions. Second, oftentimes there's changes in the literature, new circumstances upon which you might render a different pathway of care. So taking full advantage of all the information that's available so that when you make that judgment on that patient, you have the benefit of all the learning that's available to support you in that decision. And then third, as a society, as we want to evolve around what works and what doesn't work in healthcare, make sure that we're capturing the information that what happens to your patients based on the interventions that you've prescribed can be shared across a network of researchers who can constantly evaluate what is the best pathway of care going forward for the future clinical studies.
And now let's talk a little bit about saving money. Is there any low-hanging fruit out there that could be addressed in the short term?
Oh, billing and collections are a frustration to every physician I've spoken with. If we see our standards and strategies move forward, we hope to reduce dramatically the cost of that billing and complexity, and working closely with the insurance industry to achieve that goal.
And how does health IT fit into that transformative technology?
Well, the president believes that as a nation, we need a future, an economic future that's focused on sustainable growth and quality jobs. He published a strategy for American innovation in the fall, and healthcare IT sits right in the middle of that strategy. Because as we know, to address the long-term conditions in our healthcare system, we're going to have to find a way to bend the cost curve, improve quality, improve patient satisfaction. It's hard to see that future without a foundation of information technology.
And talk a little bit about comparative effectiveness. What infrastructure and data analytics are necessary for this to be successful?
If you visit a Walmart today, every single time you see you leave the retail chain, they have researchers mining every single transaction to know exactly what promotion to run to convince you to buy the next big thing. In healthcare, we have no comparable scenario of researchers mining what the experience is. If we think about comparative effectiveness, in a sense, the simple step is how do we create an environment where you can, at your choice, share information with those who can then mine that information so they can make better judgments. Kaiser Permanente and a number of the integrated delivery systems that have invested in health IT have already demonstrated the power of research and analytics when they can mine all the data that's coming out of their health IT systems.
And are there any lessons that healthcare sectors can learn from the private sector?
Well, absolutely. Again, you go to the retailing sector, you go to the others, where when people treat data as an asset and they try to learn what they can off of that information, then great things happen. Even in the area of information services. I mean, we have in our environment, if you're an investor, if you're buying stocks and bonds, the SEC set forth a set of rules of the road so that companies report in a standardized way their health of their financial performance. Bloomberg and other companies have created a $10 billion industry just taking that information and making it more useful for the American people. We hope and envision a new growth rate of healthcare information services companies who can take all of this new information as it comes and make it useful to the doctor, to the patient, and to other stakeholders in the system.
Great information. Thank you so much, Mr. Chopra.
Thanks for having me.